Thank you very much, Lena, and thank you everybody who is here this afternoon. My name is Angela Kydd. I'm a clinical professor in nursing, and I have a joint role across Robert Gordon University and NHS Grampian. And I'm trying to get onto my next slide. Hold on. I want to start with thanking Dimitris Skoulis, who's the Vice President of EMAS, and he's a member of the editorial board of the journal Maturitas. And I also want to thank Irene Lambrinudaki, who's the editor-in-chief and responsible for the gynecology endocrinology side of Maturitas. And I've had the privilege of meeting them when they came over to Edinburgh when I worked at Edinburgh Napier University to give a seminar on the menopause. And I want to give a very special thanks to Professor Margaret Rees, who is Editor-in-Chief of Case Reports in Women's Health and Executive Director of the European Menopause and Andropause Society. And she was the one that really threw me into this topic. So I just wanted to put a special thanks in for her. So here we are, Scotland and Aberdeenshire. You'll see there's a map of Scotland, and you'll see on the right-hand side the Grampian area, which is in purple, and Aberdeen is the little green spot on the coast. And I've put as well a picture of the River Dee that runs through Aberdeenshire, just to let you know where I'm from. So these are the institutions I work across. We have a lovely purpose-built university, Robert Gordon University in Aberdeen, and I thought I'd show you a picture of one of the hospitals in Aberdeen. I think there are 14 across Grampian, and this is the Children's Hospital. So that's just to set things in motion. I'm going to start this talk by talking about my personal and my professional experience of the menopause. My background is that I'm a nurse, I'm an educator, I'm a researcher, and I'm female. My specialist subject is gerontology, and I had absolutely no knowledge of the menopause. Not personal, I didn't even know I went through the menopause. It just came and went, and I didn't have any symptoms at all. I didn't really come across the menopause in my nursing life, and nor in my education experience, and I certainly haven't done any research in the area. And I acknowledged my ignorance and came out in 2016. And this was when I was kind of thrown into it by Professor Rees. And I became interested because I published a paper for Maturitas and became friendly with Margaret. And she advised that we could have a seminar on the menopause at Edinburgh Napier University where I worked. And I was really, really keen that we did this, because I felt that this was a huge blind side in my knowledge. And I was quite happy to organize the seminar. And then she said to me, well, you can give one of the talks. And I said, I don't know anything about the menopause. And she said, well, shame on you, Angela Kydd, this is how you're going to learn. And so I started asking around Edinburgh Napier University, who else was ignorant? What did people know? And I was really surprised that there were only 2 lecturers in the School of Health and Social Care at Edinburgh Napier University who actually included a talk on the effects of the menopause in their lectures. And both were specialists. One was a specialist in epilepsy, and one was a specialist in learning disabilities. And they both said that they felt that it was a really important topic because people who were epileptic or people who had learning disabilities were sometimes treated for challenging behavior when they were actually suffering severe symptoms of going through the menopause. And I asked around my colleagues in the School of Nursing, and I couldn't find anyone in the women and child health subjects or in mental health or general health or aging studies who actually included the effects of the menopause in any of their healthcare lectures. And to my shame, I never had. And so this is what really got me even more interested. So I contacted occupational health at Edinburgh Napier University, and they had no specific health advice strategies at that time. They may have now for menopausal women. And as I went around asking, I became known as the person that was asking about the menopause. And people started telling me stories of their nightmare experiences of trying to manage a menopause quietly while doing a demanding job. And one person told me, and she must have been in her mid-50s, she said that from the age of 45, she knew that the menopause had, looking back on it, adversely affected her career advancement. And she called herself the slow professor. She said many years, about 6 years, she suffered from anxiety, depression, inability to make decisions, and she was really terrified that people at work would think that she was lacking in interest or slow, and this really worried her. And at that time, the university was working towards the Athena Swan, which is a kind of kite mark that seeks to address women in the workplace and celebrate women in the workplace. But when I looked at the categories that the Athena Swan application measures, it put people into these odd age groups of under 35, 35 to 54, and 55 plus. Now, in 2017 at Edinburgh Napier University, we had 902 female staff. 18% of those were under 35. 44% were in the age bracket of 35 to 54, and 20% were over 55. So I thought, well, I wonder how many people are in the menopause bracket taken typically, but obviously there is no typical age for a menopause, of 45 to 55. And I was able to sort of break down the age and gender of the employees at Edinburgh Napier University, and just taking a very rough guide of how many females we had working in the university in the age bracket of 44 to 55, there were 282, which is just over 30%. And that was really surprising that there were no policies. So in 2018, I joined Robert Gordon University. I passed the baton on to somebody at Edinburgh Napier University, and I don't know where it's gone from there. But I spoke to several women about the menopause, and people were so eager to talk because they said the derisions and sniggers of those who do not recognize the severe physiological symptoms a menopausal woman has, such as somebody gave me the example of needing to have an airy and cool office when other staff were complaining in an open plan situation if a window was opened. People who suffered night sweats, lack of sleep, people having to change their beds maybe 9 or 10 times a night, and the lack of sleep causing anxiety and depression, memory lapses, and the need people felt to try and hide their suffering. And it became clear that we really need to talk about the menopause. Now, the occupational health services at Robert Gordon University do have a good referral link to the Aberdeen Menopause Clinic, but there was a blind spot in the Human Resources Department to acknowledge the implications the menopause has on a woman's ability to work. And the menopause is rarely discussed. And given that many women of menopausal age are in work, it's important that staff know the issues that surround trying to manage menopausal symptoms in the workplace, because this topic is everyone's business, as it's important to support colleagues going through what can be for some a very stressful time. And the menopause, if not properly treated, can have detrimental consequences on long-term health, physically and psychologically. And there is a lot of help available if one knows how to access it. There are specialist clinics, there are menopause cafes, there's symptom management both with and without hormone therapy, and alternative and complementary therapies. And of course, what women can do for themselves. And of course, the focus of my talk today is of what employers should be doing. The workplace is not always geared to helping women who experience severe hot flushes, poor sleep, anxiety, difficulty in making decisions. And some of my colleagues would tell me even lovely ones like, not being able to decide where to go on holiday and then becoming very anxious about this. And in some cases, people suffered from depression. And the menopause does seem to remain the last taboo in many areas of work. And throwaway remarks such as someone is, oh, just going through that time, or, oh, they're hormonal, serve to silence women who are suffering. So I had a look at the Robert Gordon University figures, and we employ about 1,500 staff. And of those staff, a total of them, 880 are female. But when I tried to break down the age range and the gender, I couldn't do it. I couldn't get the tables. So what I did was I took the age range of 46 to 55 and found out there were 361 people just in that age bracket. So even 50% of those, given that nearly 60% of our staff are female, would be 180 women who are in that sort of menopausal bracket. There could be people younger and there could be people older going through the menopause, but it was just to sort of point out the size of this problem. So how people experience the menopause? Well, it's not a uniform experience, as anybody who's in my age group will know. I mean, I didn't have any symptoms whatsoever, and I was so glad to get rid of my periods because they were so painful. So I was almost having a party when I'd been through the menopause. But there is a wide range of physical and psychological transition symptoms, with uncertainty whether these symptoms are caused by hormonal changes or through a domino effect, where one symptom causes another. So, for example, hot flushes can cause insomnia, which can lead to anxiety or poor decision-making, depression. And the menopause can have positive and negative effects, but usually it's the latter. So I don't know the audience I'm talking to. Some of you may be highly experienced gynecologists, obstetricians, or menopause specialists, and some of you might just be interested from a human resources point of view. But the physical effects of the menopause include hot flushes, some of which can go on for years, genitourinary syndromes of the menopause, recurrent urinary tract infections, osteoporosis and osteoarthritis, cardiovascular disease, and dementia and cognitive decline. And the psychological problems associated with menopause are difficulty in sleeping, anxiety, low mood, depression, feeling exhausted and feeling worn out, a poor memory, and a lack of concentration. And I remember going to an EMAS conference in Amsterdam several years ago, and I didn't understand a lot of the biology in one of the talks. But when somebody was talking about what happens to the body when a woman has a hot flush, it was actually horrific to think that the brain is getting flooded with toxins. So looking at the effects, now this is one of these sort of clever dick slides that I didn't make up myself, it was made up for me. But it's very indicative that good cognitive health enables us to perform well. We can engage with others, consider advice, and we can take new ideas on board. Excuse me. So we have the ability of problem solving, and we can find solutions to complex problems. We have short-term memory storage, and we can manipulate information. We have recall. We can recall times, places, and we can put our knowledge into context. We can focus. We can block out any distractions when we need to do a certain task. We can be responsive, and this is our ability to perform sequentially and smoothly, and we can do things accurately and in a coordinated manner. And we can plan. We can manage all our cognitive abilities to plan for the future. And this part is our working memory. So this is our calculation and problem solving. And then our episodic memory. This helps with our recall of times and places. Our focus is our attention span. And our responses are our processing speed. And with planning, we use our cognitive executive function. So good cognitive health helps keep us healthy habits, and we can take on new healthy habits. But when under stress, when we're anxious, or when we're sleep deprived, concerned about physical health, and we cannot think rationally, the working memory and episodic memory sort of goes into paralysis. We can't make a decision. We become fuzzy and forgetful. We are easily distracted. We can become slow and indecisive, and we can feel that we're stuck in a rut. And poor cognitive health can also lead to poor health habits. So symptoms that are frequent and severe include anxiety, depression, headaches, migraines, lack of confidence, inability to concentrate, embarrassment, fatigue, and self-consciousness. And this in turn can lead us to reduced engagement, increased irritability. I remember one student nurse, when I was talking about the menopause, was saying, "Oh, I'll be so glad when my mother gets through this. She's impossible to live with." There was absolutely not one shred of compassion going on for this poor woman. Erratic moods, reduced ability to meet deadlines for obvious reasons, reduced organizational commitment, reduced job satisfaction, and in some cases, a desire to leave the workplace because it just becomes unenjoyable and too difficult. When you think about the nature of support in the workplace, pregnancy and return to work following maternity leave are commonplace topics for human resources, but not so for menopausal women. And papers such as those by Paul and Matthews suggest that employers see the menopause as personal and private. And on the whole, there's little guidance for human resource professionals on supporting women through this stage of their reproductive lives, in contrast to pregnancy and maternity. And of course, the working environments and the conditions that people work in can actually make things worse. And this could be inadequate ventilation or very high temperatures or humidity, stress-related workloads, lack of access to toilet facilities or cold drinking water, or indeed quiet areas of rest. Confined spaces and crowding can be very uncomfortable. Working with uninformed colleagues, when it becomes either embarrassing or it becomes a joke or it becomes derogatory. Unsuitable uniforms or workwear, the physical demands of the job, and shift work. And Unison, who have a paper that came, a booklet that came out in 2020 this year, The Menopause is a Workplace Issue, Guidance and Model Policy, have said that many women are being driven from the workplace because they find that adapting problematic symptoms around inflexible work expectations is just too difficult. And others may find that managing symptoms means that they miss out on promotions and training, reduce their hours, lose confidence in the workplace, and see their pay levels drop, all contributing to a widening gender pay gap. It's also important for employers to implement a policy concerning menopause in the workplace. We know it would be good practice. It can help raise awareness and understanding. It supports employees to discuss their own symptoms. It's also good, to clearly set out the different options and support available to employees going through the menopause. And that's on a humanity point of view. But there is a warning that comes with this, because when considering requests for flexible working, employers should be aware that such requests may fall under the reasonable adjustments required to be made for disabled employees. And employers may also be liable for the actions of their employees. So it's therefore important to educate staff and to provide reasonable adjustments for staff who have health issues. And we had a case in Scotland, Davis versus the Scottish courts. And this was an employment tribunal that upheld an unfair dismissal and disability discrimination claim of a court officer whose menopausal symptoms led to an incident in which she thought her medication had contaminated a water jug, the contents of which were drunk by two men, and she was dismissed. She'd actually put some powders for cystitis, she thought, into this water jug, and then it was drunk by these two men. So she was dismissed. She later found out she hadn't done it, but she did fight the dismissal, and she won £19,000 in damages, and she was given £5,000 for pain and suffering. What can women do to help themselves? Well, the British Menopause Society came out with a set of guidelines in 2015, which I think have remained virtually unchanged, that to keep a healthy diet, low in saturated fat and salt, rich in calcium and vitamin D, take regular and varied exercise. If you smoke, to stop smoking and to drink only in moderation, to make use of screening services, to stay calm and positive, and to talk, and not be embarrassed to talk about the menopause. The other thing people have done is go online. And there are very good resources online, such as Manage My Menopause or Menopause Matters and the Daisy Network. EMAS, a group of people led by Amanda Griffiths, came out with the following 7 recommendations. And I think this was a position paper that they had published in Maturitas in 2015. And this has been used by many policy documents since then. And these are to raise awareness. And they point out that training is not just for managers, but for all employers and employees. And this can be done online, with leaflets, with articles, with study days. Knowing what women will find helpful is useful, and emphasize how everyone can provide support. The other thing is a culture of openness to allow disclosure of troublesome symptoms. Many women are uncomfortable disclosing their symptoms to managers and co-workers, and we need to have knowledgeable, sympathetic managers and colleagues who will make work adjustments. There needs to be a review over the workplace environment, which is like temperature and ventilation. So women going through the menopause should be able to sit near a window so they can have control over opening or closing it, opening and closing blinds, managing air conditioning, having a desk fan, feeling free to discuss with fellow workers. And reduce work-related stress. Midlife women report more work-related stress than other groups of workers, and reducing potentially stressful working conditions will help. And sometimes the menopause attracts this workplace banter from colleagues, who will joke about it. And women can find this embarrassing and stressful. Allowing flexible working arrangements is really helpful, especially if sleep patterns are disturbed. Providing access to cold drinking water, which is helpful for managing and reducing the intensity of hot flushes. And ensure easy access to toilets. Women who have heavy bleeding and I think there's an estimated 8 to 27% of menopausal women who will have urinary incontinence, need to have easy access to toilets, and this will make these issues more manageable and cause less anxiety. Managers have an important role to play in ensuring that anyone experiencing menopausal symptoms gets the same support and understanding as if they had any other health issue. If there was the same amount of sniggering and derogatory remarks made about somebody with a mental health issue, there would be a walkout of staff. So why isn't this happening for people undergoing the menopause? And this came from a CIPD document, which I've referenced at the end. And it's a really useful document called The Menopause at Work, a practical guide for people managers. There is really no reason why human resources can't have policies, because there are many off-the-peg policies that can be used. Unison have a guidance and model policy, and I've put a link there to this guide, and it helps organisations to consider how menopausal symptoms can impact on women, trans and non-binary people experiencing the menopause, and to treat the issue with the critical importance it deserves, with policies and procedures to protect and not to disadvantage people. Then I came across the Expert HR Menopause Policy, which is an example document. It's very detailed and it can be accessed. You have to sign in. If you do go online to this, you have to sign in and register, but that's all you have to do. And then you can get hold of the policy document, which can be easily adapted to suit any individual organisations. The Royal College of Nursing has a really useful resource online called Women's Health Menopause. And one thing I liked about this resource is it has a table it documents the symptoms, and then it documents how this could interfere with work, and then it documents suggested adjustments that can be made. And then the CIPD guide, which I referred to earlier, Championing Better Work and Working Lives, is a really practical guide for people managers on the menopause at work. So some of the resources I've put here I found really useful. Amanda Griffiths and colleagues, and I know Margaret Rees and Irene were involved in this work. They put forward the recommendations for workplace conditions for menopausal women, and this was the position paper on menopause. Lines that greater awareness among employers, together with sensitive and flexible management, can be helpful for women at this time. And then the Faculty of Occupational Medicine of the Royal College of Physicians has really good guidance on menopause and the workplace. And this is a fact sheet with guidance for managers and employers, and has really good recommendations for good practice, which really are a mirror of what Amanda Griffiths and colleagues have done. Rachel Weiss, who's the chair and founder of the Menopause Cafes, and I had the privilege of meeting her. She's a real bundle of energy. She set up the Menopause Cafes, and there is a guide to setting up a menopause cafe if anybody wants to host one. And she also has been having this menopause festival called Flush Fest, and the next one takes place in 2021, April the 30th and May the 1st. If anybody wants to come to Perth in Scotland, the details can be found there. And this is a 2-day event celebrating and really raising awareness about the menopause. And this group have done a lot to make the menopause less of a taboo and more of a topic of concern. And then there's the Women's Health Concern, which has a really good fact sheet, and the Menopause Matters website. And I thought that this, especially if people from human resources are here, would be a good resource for people to have. So that's my talk. I'm really proud of Robert Gordon University to say that the Human Resource Department had taken on board that they didn't have a policy, and they have a draft policy. It hasn't come out yet, and it was delayed by the obvious distraction of the pandemic, when everybody had to divert attention. But this work is going through, and our Human Resources Department will have a menopause policy in place, which I'm really pleased to report. So thank you for your attention and your time, and I hope it has been useful to you.
Thank you, Professor Kydd, for such a wonderful presentation. And now for the Q&A session, we will wait for a few seconds. I remind you that you can submit your text questions at the questions panel in your webinar control panel. Well, it seems that we do not have any questions for the moment, but we do have messages as this was great, Professor Kydd. Thank you. Very, very relevant lecture. And congratulations.
That's really nice to know, actually, because when you give a webinar, you don't know who you're talking to. You know, I mean, I'm sure there are many, many experts in the audience. I don't know who I'm talking to. So it's really quite unnerving.
I imagine. Okay, so, well, it seems that we do not have any questions. Are there any final thoughts you'd like to leave us before ending today's presentation, Professor Kydd?
I think my final thought would be, it's everyone's responsibility to ask if their workplace has a policy and their occupational health department have a policy on managing the menopause in the workplace. Because all the resources that I've listed it's just so easy for people to pick them up and use, and they've been designed by experts. So I think that would be my take-home message, is I came out as being ignorant in 2016, and wherever I've worked, that's one of the first questions that I ask now. It's too late for me, but I think it's really important.
Well, actually, we have one question, sorry. Do you think in the future we'll see regulations for paid leave for women going through menopause?
I would hope so. I would really hope so. And I think it also would show that the women have the confidence to go to their general practitioners and report the problems that they're having, because you would be signed off sick. I mean, take the menopause out of it. If you couldn't sleep and you became anxious and depressed, you're not well enough to work in some cases. So I think that's why adjustments have to be made in the workplace to help people to continue working. But certainly if people have very severe symptoms, then they should be afforded the time of sick. And I think that's a really good question. I've never seen anybody off sick because of the menopause.
Perfect. Well, Dr. Kydd, as I told you, we don't have any more questions, but we have a lot of messages. Great presentation, well-researched. Thank you. Very important topic, midwife listening from Sweden. Thank you for this presentation. It was very helpful and comprehensive.
Thank you very much.
Okay, Professor Kydd, again, thank you so much for your lecture. This concludes the webinar. Thank you so much for your presentation and all the attendees for being here today.
Thank you very much, Lena.